As the name already implies, the IASLC is the International Association for the Study of Lung Cancer. So we promote exchange between all ideas, between all countries. We are multidisciplinary, so not only thoracic and medical oncologists, but also thoracic surgeons, radiation oncologists, pathologists, and so on. Even patient advocates and patients themselves are invited to this conference. We are international, and we try to accommodate as many countries as possible and have some exchange of ideas between all different countries. And we have specific committees looking at specific international collaboration. To be honest, it's my last day as president of the IASLC. In a while we have the General Assembly, and then Dr. Kai-Kun Cho will take over from Shanghai as president of the IASLC. So he's a medical oncologist, I'm a thoracic surgeon, but I was chairing the first presidential symposium where the FLORA-2 and the HARMONi trials were presented. So I can comment on those two trials. FLORA-2 was first-line osimertinib with chemotherapy versus osimertinib monotherapy in EGFR-mutated advanced non-small cell lung cancer. And they updated the final overall survival data, which were presented at the conference. We already know that progressive-free survival was significant for this trial. So now we have as primary endpoint, so progressive-free survival was updated, and as secondary endpoint, the overall survival. There were 279 patients in the osimertinib with chemotherapy arm versus 278 in the osimertinib arm. The hazard ratio for overall survival was 0.77 with a p-value of 0.02, meaning that the combination of osimertinib with chemotherapy yielded a significant survival benefit, overall survival then, compared to the osimertinib arm. So this was also important to mention, is that it was consistent among all subgroups and that the toxicity and the tolerability were very manageable. So in conclusion, that the first line osimertinib with chemotherapy yielded a statistically significant overall survival benefit, which was also clinically meaningful, and that's also important to mention. The methods of action are different. And so this is really a way forward to treat those patients with a combination of chemotherapy and osimertinib. This was a study of ivonescimab versus placebo with chemotherapy, phase 3 study, in patients with EGFR-positive non-small cell lung cancer who progressed with third-generation EGFR TKI treatment. Ivonescimab, I'm not a specialist in specific antibodies, but those are directed against PD-1 and VEGF, the vascular endothelial growth factor. So there were two arms randomized in a 1-to-1 fashion. Arm A got ivonescimab with chemotherapy, carboplatin and pemetrexed, and the second arm B got placebo with chemotherapy. And then arm A continued with ivonescimab and pemetrexed, and arm B with placebo and pemetrexed. Brain metastases were allowed in this study. Primary endpoints were progression-free survival and overall survival. In arm A, there were 219 patients, and in arm B, 219 patients also, so given a total of 438 patients. So again, this was a large trial. The primary analysis in 345 patients showed a progressive-free survival in arm A, which was best. Hazard ratio was 0.52, p-value smaller than 0.001. Median progression-free survival in arm A was 6.8 months, and in arm B, 4.4 months. And this was also consistent among all subgroups. Regarding the overall survival data, the hazard ratio was 0.79, so this was still premature, with a p-value which was borderline significance, with a p-value of 0.057. So the conclusion of this study was that in arm A, combining ivonescimab with chemotherapy, there was a statistically significant and clinically meaningful benefit in progression-free survival, but there was a trend in overall survival, but we need more data to give more definitive information on the overall survival.